So with that, we will get started with questions.
Doctor, we have the schools that will start testing on Monday. We've had colleges testing for a couple of weeks. How are their numbers represented in the overall numbers that you report? Is there a way to separate them out?
We do have access to the data based on what numbers the colleges in particular are testing currently, because the rapid testing and the testing system for K through 12 will be starting September 14th. We are working now on ways to be able to display that publicly, and we're just taking it a step at a time. We'll be able to get to that, but we appreciate what our institutes of higher ed have been doing in building out strong testing programs as one piece to the comprehensive COVID control plan that we know is critical.
Governor, the federal aid money toward Ireland, the $1.25 billion, you're now saying you're going to hold on to most of that in the hopes that maybe that could be used to help fix the state's budget if Congress doesn't provide more funding, or if they change how you can use that money, because it was supposed to be used for immediate need. Do you think there is not that immediate need? You know, we've heard over and over small businesses want access to that money and they need help. They're struggling. Looking at how the money's been spent so far, an overwhelming majority of it is on supplies and healthcare and PPE, and only about $7 million has gone to businesses. Do you think there's just not the need? What do you say to those businesses who thought a lot of that money was going to be going to them to help them get through this, or to workers?
So, as you say, I'm making decisions in a sea of uncertainty, and trying to do the best I can to provide for the needs of Rhode Islanders, keep people safe, and also hold some back if at the end of September Congress says, sorry, no more money, just use what you have and try to balance your budget, which is a distinct possibility. So, as you say, I think we've allocated the majority of the money primarily to testing. We spent $100 million on PPE, ventilators, surge hospitals, the immediate needs, quarantining, isolation, et cetera, which was necessary and what the money was for. Some of it is for rental assistance, housing assistance, $50 million for small business aid, another $50 million for the Back to Work program. You know, well over $100 million is direct into the economy. Could we do more? Is there a greater need? Without question. I just feel at this point in time, if you look at everything and the huge uncertainty from Congress, we just have to, you know, I'm trying to make the best decisions I can. You know, some to businesses, more than $100 million to the economy, a lot to testing, contact tracing, and then just a cushion in the event that we don't get more. You know, $50 million is to help reopen the schools. There's just a huge amount of need right now. That $1.25 billion is not even close to enough of the relative to our need. Some of it went to nursing homes, some of it went to hospitals. We could spend easily 3 times that to meet the needs, and I'm just trying to do our best.
Governor, as a follow-up to that, the new fiscal year began 6 weeks ago today. And every week the budget deficit is growing. You and I talked 4 or 5 months ago about having to do structural change to the state budget. And the budget's grown $1 billion during your term. Yeah. I know there are a number of factors to that. What specific measures have you taken to rein in the spending and make up for what, you know, taxes off, casinos are off, hotel, hospitality, all of that? Here we are 6 months after the pandemic start. We still don't have a budget. Congress is still up in the air. What specifically have you done to address the budget hole that, even if you get a pile of money from Washington, is still going to be there in the months going ahead?
Yeah. By the way, maybe not. Like, if they were, some of the Democrats' proposal, Speaker Pelosi's proposal on the table, the Senate Democrats would be terrific and go a long way towards helping us. So I do want to say that. Having said that,
but in the out year, I mean, even, you know, this is a history of Rhode Island.
Yeah.
We plug the hole with the tobacco money. We plug it with this. You're plugging it with Congress. You had a $200 million structural deficit with the budget that you presented to, you know, initially when you bridged the gap when you presented to the General Assembly.
Yes, I did just want to make clear that if Congress chooses to do the right thing and passes a bill, it'll prevent a lot of pain and suffering and economic disaster in our state and many other states. So a couple things. In the immediate, we have a hiring freeze. We've pulled back on our spending. We're doing a work share program. We did a program with state employees. I appreciate their cooperation to reduce spending. No new programming, like really in the immediate, trying to tighten our belt. I know cities and towns aren't very happy at the moment because we're constraining what we send out to cities and towns. So it's a broad belt tightening across the board. In terms of the long run, it's a combination of things. The biggest nut is spending on healthcare, over $1 billion on Medicaid. And I have done, in the time I've been governor, an awful lot to bend the cost curve on Medicaid. It's why I'm trying to keep folks out of nursing homes and keep them in home care. Keep folks out of hospitals, keep them in primary care offices. That's where the money is. Also, we have to keep people working. If you want to solve your budget deficit, the best way to do that is in part to grow out of it, get more people back to work. So, since I've been governor, we have constrained spending. We have 1,000 fewer state employees now than 10 years ago. But the big nut, the big expenditure is healthcare spending and Medicaid. We've done some, we haven't done enough, and that's what we have to keep doing.
Final question on this topic. You continue to resist furloughs and layoffs. And it's been 6 months. You had that voluntary program. Nobody's lost a paycheck. And so Bob Flanders famously said in Central Falls, it's better to take a haircut than a beheading. And as you look down the line, people are saying, why are the state workers? And it's not a vendetta against the state workers.
No.
What plan do you have right now in place that if Congress doesn't come through or whatever to say, look, 20% reduction, you got to take a day off, whatever. We haven't heard anything.
So here's how I see it happening. I think it's safe to say that if Congress doesn't do something, in the next month, they're not doing anything by the election. So I'm talking now actually to House and Senate leadership to say, let's give ourselves a few more weeks to see if Congress does something before they head off to go run for office. If they don't, we're going to have to reconvene and pass a new budget. And that budget will absolutely have layoffs, will absolutely have cuts to social services, will absolutely have all the stuff that I've been trying to avoid. And so that's what we're doing right now, is putting that on paper. If there is no more money, then the question will be how many layoffs? How much of a cut to cities and towns? How much of a cut to, then that's going to be really tough, which is why I've been trying to avoid it.
Millions of dollars, could you not have saved tens of millions of dollars starting this 4 or 5 months ago and had more money to play with?
Not really. I don't think so. Look, again, it's a judgment call. It's a judgment call. I don't think so. Maybe some millions of dollars, but then we would have put a lot more people on unemployment rolls, which I don't think would have been the right thing to do.
Governor,
There's no free lunch in this one.
Can you give us an update on the walkthroughs? What % of the schools have gotten the walkthrough?
They will be done by the end of the day today. So they're probably happening right now, so I don't know exactly what %, but by the end of the day today, they will all be done. By and large, I'm really pleased with the work they've done. We've gotten a lot of positive feedback from principals and superintendents, school officials saying, thank you, that was helpful. Some of the schools haven't yet passed. I'm hopeful that they will all pass. They still have between now and Monday to get, into compliance. So they're working on it. Some of them haven't had an isolation room, haven't had a big enough isolation room. So we're helping them to get ready.
And based on the numbers right now, on Monday, did you say Providence, Central Falls are still the only districts that are not cleared? But if the numbers continue, is Providence then cleared to go back?
We hope so. That's what Dr. Alexander Scott said. We're going to have a look at it again in about a month. And if the numbers continue to look like they are now, it would be fantastic if we could clear them.
And one final question. This COVID contest, what's the name of this contest?
I don't know. do we have a name? You have stumped me. Come up with a good name. A free night out? I don't know. I don't know. Come up with something.
All right.
Governor, related to the inspections, or pardon me, the walkthroughs, I've heard from several people who are involved in those teams, and there seem to, this may be for the doctor as well, there seem to be some infrastructure gaps, for example, with the MERV rating of the air filtration system that can be installed, where in the vast majority of the buildings can't handle, from an electrical standpoint, what would be required to have that level of filtration. And so this is a two-part question. Number one, you mentioned $50 million to schools. Are you willing to put more money into schools right now to try to upgrade infrastructure around the state so that you can have higher grade, for in layman's terms, higher grade air filtration immediately? And number two, what are the exact criteria that you're looking for in order for a school to pass these walkthroughs?
So I'll let Dr. Alexander Scott answer half of that, but I'll say a few things. So far, no cities and towns have applied for any of the 50 million. So am I willing to maybe put more out there if it's necessary? But well over a month ago, we said, here's 50 million, and we haven't had any request for it. So let's see if we need more than 50. Secondly, there's more than one way to skin a cat, as they say. In some of these buildings, opening the windows is sufficient, putting a box fan in a window is sufficient. We've ordered many of these HEPA filters, so we're going to do what we can to help them get there. In fact, some folks on the National Guard even worked over the weekend in the city of Providence to install some of these fans. So the short answer is yes, we'll do whatever we know how to do in order to get them to a place where there's enough air flow. And there's specifics around that.
The governor answered that perfectly. We actually have a checklist that goes through the different components that are in place, but a key approach to it is under air circulation. Here's one option, which is the MERV or some other form of an HVAC system. If that's not in place, here's the next option. If that's not possible, here's another option. So we really have an algorithm that allows for schools to take the different approaches to get to the same outcome. That's a key, and it's an important message for the public to understand. It doesn't have to be only that specific MERV type or some other HVAC in order to qualify for getting the type of air circulation that we feel is safe and works well in an environment at school. The open windows, as the governor has shared, different types of fans is possible, and we want to make sure that all options are on the table so that as many students and staff that are present can be in person to learn safely. We can work offline to get you a copy of the checklist that will go through some of the specifics as an example, but they were essentially pulled from the facilities guidance document that we have already shared and is available for schools.
Is that the primary role of the National Guard in this interdisciplinary process, to make modifications to buildings that, like we've got schools that the windows won't physically allow for the installation of a box fan, you can't put a MERV filter in, et cetera, et cetera. Was that what the Guard's there? They literally saw open windows so you can put a box fan in?
The Guard can do it all. They have been amazing, but it's not the only role. Our interdisciplinary team that the Guard is a part of works collaboratively. These are working sessions with the schools to see what unique approaches will work for you. We've also brought on additional expertise, as we've shared, in HVAC engineering, other colleagues who have committed their time to understanding the different dynamics and what can work, and then just out of the goodness of their hearts over the weekend and in general, we've expressed that commitment to schools and supporting and helping schools in actually putting the measures in place. All of this, as the governor has shared, is above and beyond what we know the schools are responsible for being able to do, but it's because we're committed as a state to do what it takes to make it safe for families, students, and staff, teachers to return to school.
Doctor, there's been some news reports with colleges, students being suspended, expelled. I understand Providence College had some disciplinary incidents. I understand URI had some disciplinary incidents. There was a well-publicized incident up in Massachusetts where several students were expelled permanently, and the school isn't even going to refund their tuition. This has been widely publicized. Do you and the Department of Health have a concern that these types of punitive measures against students will interfere with the willingness of the people affected to participate willingly in contact tracing and case investigation, or by creating punitive outcomes for these students, we may be providing an affirmative incentive for them to basically lie?
What you describe is something that we are not focused on. What our focus is on helping the students be able to have the environment that they need to get the education that they need and deserve as safely as possible. And we want to use every lever that's needed to help accomplish that. Schools have a code of conduct that is expected of students. It is now different, similar to how we're approaching things differently in K through 12. Students have the understanding. We need to wear masks. We need to distance. We need to be able to wash hands regularly. Those are simple, clear rules that students can follow, and it's a normal part of adulthood to be held accountable with consequences if you're not able to do that. We also encourage and expect that students understand case investigation and contact tracing is one of the most valuable tools we have to keeping them safe, their classmates, their teachers, and families safe. So we have full confidence that students will get this and can engage in both following the rules and supporting the systems that we need to keep everyone safe so they can be here, because no one wants to be expelled, no one wants to be suspended, and I'm sure many of them don't want to return home. And we want to make it an environment that if you follow these rules, let's have a strong academic school year together.
Well, of course, sending students home would expose whatever the communities are that they're being sent to the infection if they're affected. Have you and the Department of Health had any conversations with the institutions of higher education about this issue, and to what extent?
Absolutely. We're working very closely with school leadership. Institutes of higher ed across the state have taken this very seriously. They've put together very comprehensive plans. No one wants to send anyone back home. No one wants students to be suspended. We do want students and staff to be in a safe environment to learn and be effective. And that includes consequences when that's not followed, and hopefully we won't have to continue to implement those consequences because students will get it and we'll just be able to work together on making this a productive school year.
Governor, you mentioned some of these.
Thank you. Governor, the Massachusetts governor hasn't made any changes in regards to restrictions for Rhode Islanders to go to Massachusetts. How are talks been with Rhode Island and Mass in regards to getting Rhode Island off the restricted list? Talks have been very productive. We are pleased to say that our numbers here in Rhode Island, specific to cases per 100,000 over the last week, is below the number that is required for Massachusetts. So we're actively engaged in discussions today to be able to have their rules reflect what we know that we have and are seeing. So we are very encouraged by that, and we'll work with them to get to the update.
Tanya Signori from the Rhode Island Echo. To any of the three of you, We just look back at the way we used to live. No masks, no anything. Kind of germs everywhere, schools, stores, hospitals we would walk into, nursing homes, and no mask, no protection, no anything, just a bunch of germs in schools where a student passes it to another student. And 5 kids get it, they bring it home to their families. I think schools are much cleaner now, considering everything that's going on, a lot less germs. Great filtration systems, things like that. A, do you agree? And B, your thoughts on that?
Yes, that is our goal, to be able to ensure that the environments are cleaner and people are more aware of what's around them. And we, again, emphasize the importance of mask wearing, the importance of being able to stay home if you have any symptoms. The entire state now is educated on those simple components that contribute to the spread of illness. Through coronavirus, we've learned this. It's going to be helpful in applying to the flu. Many people look back at the pandemic of 1918, and many of the steps we're implementing now worked for then as well. And so it should make us better overall. Environments are cleaner, people are safer, and hopefully less illness will be transmitted.
Thank you.
Governor, a lot of people want to know where their $900 is. What should we tell them? Unemployment.
Coming. It should be, if they haven't gotten it yet, they'll get it this week. If they haven't gotten it yet, they'll get this week.
You mentioned some of these schools have not passed their walkthrough, and the hope is that they'll be ready by Monday. Is there a chance that some of these schools that were planning on having kids come back may have to push that back? Or is it basically, as the teachers would say, this is full speed ahead and you're just going to push it through no matter what?
There is a chance. A greater chance, though, is that certain parts of a school won't be allowed to open. I think it's highly unlikely, based on everything, at least that I know so far, that an entire school wouldn't be allowed to open, but maybe a particular classroom might not be allowed to be used. Similar to what we were talking about before, if you just can't figure out a way to make it work.
And sorry, I know as you stressed the importance of the flu shot, would you consider making it mandatory for school kids like Massachusetts is doing? And
not really. Sorry, go ahead.
And following up on that, would you consider doing that for the coronavirus vaccine when and if that comes around?
These are tough questions about which we are having many discussions, and I will take the lead from the truly expert staff of the Department of Health. We're going to be talking a lot about this, so I'll keep it brief now. At this point, we have made a strategic, conscious decision not to make the flu shot mandatory, as they did in Massachusetts, because we think we're going to have a better chance of getting more people vaccinated without requiring it. Does that make sense? So we want 100% of people to have the shot. We just feel that making it readily available, free for folks that can't afford it, incredibly convenient, in the community, at the grocery store, at the school, at the pharmacy, is the better approach to getting to 100% compliance. As it relates to the COVID vaccine being mandatory, we haven't started to have that discussion.
Last question for the Governor, you routinely, and I think somewhat accurately, painted a very bleak picture if we're not able to provide in-person education. And you evoked some powerful words of suicide and depression. Yet there appears to many a dichotomy that exists between education and the small business market. So I guess a philosophical question. You've applied a calculus, if you will, to cost benefit in terms of education versus potential exposure to the disease. And yet on the business market, we've moved from a 15 to 30 to 60-day flattening the curve to really a model which seems to embrace elimination of the disease. Yet the potential for these same, not a potential, it's being realized, these same long-term ramifications, depression, suicide, bankruptcy, unemployment, loss of homes, applies on the small business market. Where is the difference in calculus? Because it seems like it's two very different approaches.
I have tried to have the same approach for all of it. From day one, I have said, let's get as many people back to work as possible at all times. You know, places like in New York City, they still don't have indoor dining, you know, whereas we do. In fact, there's a Moody's study with CNN, I think, which puts Rhode Island at #3 in America for the percent of our economy that we've gotten back to. So I think I've been pretty clear from the get-go. I want as many people working as possible, as many businesses open as possible. We opened barbers and haircutters before all of our neighbors. It's a balance. I mean, there's still a lot of people struggling, particularly in hospitality and retail. But I think I've been pretty consistent. And the same is true for school. You know, I think it's better for the kids to be in school.
But and when you look at the protest, for example, that happened yesterday in the State House, we've displayed a willingness, and again, there's a calculus involved, to put groups of people together in a school building, and then reach them out of the community. Yet at the same time, significant restrictions exist on the day-to-day pursuit of commerce, and it's left that in the absence of any real bailout assistance need. I understand you're trying, but we have two alternative realities here to many of us.
I guess we could just agree to disagree. I mean, we are allowing indoor dining, weddings, events at an appropriate level. And also in schools, it's going to be different. These kids are going to have to wear masks. They're not too happy about that. Teachers are going to have to wear masks. Limited number of, they're going to be having requirements to keep a certain distance. Buses are going to be half full, approximately. So to me, it's all about putting practical changes in place to reduce but not eliminate the risk of coronavirus spread, and to enable as much commerce, as much education as possible.